Hi, I'm Joseph Vu, one of the physicians here in the Department of Endocrinology here at Kaiser Santa Clara. Graves' disease is a condition that is also called overactive thyroid. This is when there is too much thyroid hormone in the body. Graves' disease is a type of hyperthyroidism and is the most common form of overactive thyroid. Graves' disease can cause numerous symptoms, including trembling or shaking, irregular heartbeat, weight loss, tiredness, frequent bowel movements, feeling overly hot, and if you are a woman, it can alter your menstrual cycle. Graves' disease is named in honor of the Irish physician Robert Graves, who was the first to describe this form of hyperthyroidism. The exact causes of Graves' disease are not known. We do know that Graves' disease involves our immune system, which normally keeps us healthy. It is considered an autoimmune disorder, meaning the immune system fights our normal thyroid function rather than protecting it. The immune system creates an antibody which then causes the thyroid gland to become overactive. It is not clear why some people develop this antibody. We do know that Graves' disease tends to run in families, and it does occur in women more frequently than in men. When Graves' disease is suspected, it can be diagnosed using blood tests that measure the level of thyroid hormones in your body. Often, a very low-dose radioiodine scan of the thyroid is used to confirm the diagnosis. There are three main options available for the treatment of Graves' disease. The thyroid gland utilizes iodine to make thyroid hormone. Antithyroid medications such as methimazole and propylthiouracil, or PTU, decrease the thyroid gland's ability to use iodine. This results in decreased thyroid hormone production, and thyroid hormone levels return to normal, sometimes in approximately 4 to 6 weeks. And about 30% of people with Graves' disease that use antithyroid medications over 12 to 18 months will achieve a return to normal thyroid hormone levels. In these cases, there will be no need to continue medication once normal hormone levels are reached. However, the remaining 70% of patients will develop a recurrence of hyperthyroidism, in which case it would be advisable to proceed with a different type of treatment, such as radioiodine. Most people have no significant side effects from antithyroid medications. The most common effects are allergic rash, hives, or occasional fever and joint pain. And if a rash or fever occurs after starting the medication, please notify your physician. Very rarely, in about 1 in 200 people, these medications can cause a decrease in white blood cell counts or inflammation of the liver. Your doctor will monitor you closely for these rare side effects. If antithyroid medication fails to control the thyroid levels effectively, or if side effects develop from these medications, subsequent radioiodine therapy or surgery are additional treatment options. The thyroid gland uses iodine in the production of thyroid hormone. Radioiodine is a low-level radioactive version of iodine. Thyroid cells are unable to differentiate between regular iodine and radioiodine. Radioiodine can then be used as an effective therapy for Graves' disease. A therapeutic dose of radioiodine gets taken up by the thyroid gland and slowly ablates or melts away the thyroid tissue over the course of a few months. The goal of radioiodine therapy is the complete ablation of the thyroid gland, resulting in no remaining hyperfunctioning thyroid tissue. The thyroid gland will essentially be made inactive, and therefore after successful radioiodine therapy, you would need to take thyroid hormone replacement pill for the remainder of your life. This medication replaces the thyroid hormone that was produced by the thyroid gland. Radioiodine therapy is administered as an oral capsule form on a single day. You can go home after the therapy, and you will need to follow some basic radiation safety precautions. This includes maintaining a 3 to 6 foot distance from others, especially children and pregnant women, for up to a week after therapy. Approximately 2 to 4 months after therapy, thyroid hormone levels will typically fall below normal, signifying a successful treatment. And thyroid hormone replacement medication, called levothyroxine, is started at this time. About 80 to 90% of patients with Graves' disease are effectively treated with a single dose of radioiodine. And rarely, the first treatment may not be successful, and an additional radioiodine treatment may be required. Some patients may suffer from Graves-related eye complications, and in this case, additional medications may be required to reduce the risk of worsening eye disease. This would be addressed in detail by your physician prior to treatment. Thyroidectomy, or removal of the thyroid gland by means of surgery, is another treatment option for Graves' disease. Because the entire gland is removed during surgery, you will require lifelong thyroid hormone replacement medication, just as with radioiodine treatment. And because of the invasive nature of surgery, it is rarely used for the treatment of Graves' disease. Special cases where surgery may be appropriate would include patients with associated nodular thyroid disease, or patients who need or desire very rapid control of hyperthyroidism, or those with significant eye involvement due to Graves' disease. To summarize, Graves' disease is a very treatable condition with several available treatment options. Treatment preference is unique to each individual, and whichever treatment option is best for you, there will be a team of physicians and support staff who will coordinate your care and help guide you through the treatment process. Please do not hesitate to ask any questions that you may have, and thank you.